This is Glenn Bauer, and today on The Next Step TVSB, we're going to talk to a very knowledgeable guest about what's happening with healthcare reform or healthcare provision, the alternatives, what's on the table, who's doing what, and what might we expect in the future from the presidential candidates or from state electors, state legislators. Is there something happening that's going to improve healthcare in America? And specifically, where are we with healthcare in America, and where are we going, and where do we hope to go? That guest is Peter Conn. Peter Conn is with Healthcare for All, the Santa Barbara chapter, and you're the outreach coordinator?
Yes, that's right.
And Peter, thank you for coming.
Oh, my pleasure.
Tell us a little bit about Healthcare for All.
Healthcare for All is a nonprofit. We are a C4, which means that we can support legislation. We also have a C3, which is tax deductible. We are an organization of about 15 chapters at this point, from Butte County down to Los Angeles area. We're all volunteers. We have a few paid staff, but very minor. And what we do is we're advocating for a single-payer system that will cover everybody for almost everything, publicly funded, but privately delivered.
Okay, let me take parts of that at a time.
Okay.
First of all, I want to mention that in the course of the afternoon, we'll have Peter's contact information on the screen. It's 805-682-5183 is his number. He's asked me to read that out loud, and if you want to contact him personally, you can. That'll be on the screen, and there's also be a website information about how to contact the organization. There are, when you say single-pay health care, some people talk about Medicare for all, or Medicare for everyone. Is single-payer health care the same as Medicare for everyone?
Yes, it's very similar, and the Medicare for all is used because people are familiar with Medicare. The mechanism is that there is one entity which collects all of the premiums and pays all of the bills, and that helps in terms of administrative costs. Medicare runs at about 1.5% administrative cost, whereas now it's 15, 20, sometimes 30% of administrative costs.
Well, we'll talk about that a little later, because I had a little different figures, but yeah, it's an amazing piece of information that the folks need to understand. Let's go back to the local basis here. You got a local chapter of people, and they get together and work. And I think we have a photograph in the back room showing one of your events. If we can get that up in a moment, you have meetings, you have chapter activities?
We have monthly meetings. They're at the League of Women Voters office. League of Women Voters has been a supporter in our coalition for many, many years. As a matter of fact, they were part of the founding group. We have events where we'll show videos. We have marches when it's appropriate. We will talk to any group. If there's any group out there that would like to have a presentation, we would certainly be happy to.
That might be you on the screen right now, is that right?
Yes.
So there's an example of a march in which you and your chapter were active. Where was that?
This was, we marched from City Hall up to the courthouse, and then we had a series of speakers, some of the supervisors, the mayor.
People are interested in this type of participation, trying to influence the local politicians. And
right. At that time, we were supporting a specific bill. It's a little easier to organize events like that when there's something specific. Right now, the chapter is just trying to continue with the educational process, because people need to know if people do nothing else, if they will just read something or go online and go to our website and become educated. Once people know what we're all about, they don't turn back, they don't change their mind. It's when they're kind of half informed and somebody comes along, oh, we can't afford it, or the doctors won't participate in it, huge numbers of misinformation, it's socialism and so on.
Well, let's try to take a little bit of that, peel away a little of that nonsense. We are this year at the 50th anniversary of Medicare.
That's right.
So that's a pretty 50 years of a program begun in the LBJ's administration, a what today people have accepted as part of their citizenship right, or their rights as people living in a civilized modern country like the United States, that you would have a healthcare system that provides for people.
Right. For years and years, there was opposition from the American Medical Association. The propaganda against single-payer or Medicare type system was brutal. There would be films of goose-stepping soldiers and so on, and terrible-looking medical facilities. But what happened was that LBJ had a wonderful election, a landslide election, and he was able to get this passed. And at the time, there was some concern about the number of people who did not have coverage. More and more medical procedures were needing to be done in the hospital. Expenses were going up. Charity didn't work. A lot of people left out of the system. And so for seniors whose poverty rate was 30%, a good portion of that being because half of seniors didn't have insurance to begin with, and those that did have insurance, the insurance was terrible. They and their families were suffering from the system. So he was able to get that passed, and at the same time get legislation passed that established care for the poor under Medicaid, which is Medi-Cal in California.
But both of those ideas, the idea that we're going to take care of the elderly and the needy by providing them medical services at an affordable and quality level, started 50 years ago, and they become imbued in the minds of so many people, and that's an important idea. I think that when you try to explain to people, as you mentioned a moment ago, if you explain to people what it is you're trying to do, and you refer to the success of programs like Medicaid, I think that helps.
Well, also, people should look to other countries.
Yes.
We are the only industrialized nation in the world that does not have universal coverage, meaning covering everybody, and all of those have very comprehensive plans. Many of them will cover dental and vision and so on as well.
That's
for half of what we pay.
I will get to that a little bit, because I think we have an interesting chart that I might be able to get up on the screen. But let me what you just said about Northern Europe or whatever. We had presidential debates going on a year ahead of, well, no more than a year ahead of any actual presidential election, but in both of the Republican and the Democratic presidential debates to date, the question of health care has obviously come up. In the Republican side, I think the insurance plan they recommend is don't get sick, and if you are sick, die quick, or something as somebody is infamously alleged to have said, or be wealthy to begin with. In the Democratic side, there was somewhat of a difference of opinion. O'Malley and Bernie Sanders were advocating for single-pay programs. Hillary Clinton seemed to be supporting the Affordable Care Act, what has been called Obamacare, only with more modifications to attend to some failings or lapses that it might have along the way. Is healthcare for all? Have an opinion about, I mean, I know you're for single payer, so is there something about Obamacare that you find you could accept, or healthcare for all could accept, or do they want to move past that into something like O'Malley or Sanders or others have advocated?
We'd like to see the Affordable Care Act morph into a single-payer system. There is a clause in the Affordable Care Act that allows states to set up their own programs. And so our hope is that somewhere, some state will be able to put together a package and be a demonstration project, and then the other states will follow. The Affordable Care Act did a wonderful thing in terms of expanding coverage for the Medicaid population, but you can't really solve this problem incrementally. What you're doing is just adding more and more administrative costs. You can see the enormous administration that's involved in managing the Affordable Care Act.
The numbers I came up with when I was looking into this was that between Medicaid, Medi-Cal, Medicaid, Medi-Cal, and Medicare, and the military insurance, veterans insurances, almost a third of the people in America get their health care already from the government.
And actually, it's closer to 50% because you have to consider that the premiums that people pay for their insurance to work is tax deductible. That's tax money.
But just looking at Veterans Administration, Medicaid, Medi-Cal, and Medicare kind of programs, and being subtle about it, I think your point is well taken, but already we're a third of the way there on the most evident level.
Yeah,
and yet it's sort of hidden. It is hidden. When I used to do a show called Head to Head, and people would call in and complain about socialism, and one thing they would not want taken from them was their Medicaid and their Social Security, two programs that I would consider socialism in the basic sense. But already we're a third there. When Obamacare or the Affordable Care Act came on the line, the chart I have shows about, and I don't know if we have this up there, the chart on America's uninsured, what's happened. If we have that one to put up, I'd appreciate it. There it is. Maybe you look at that. It's a little hard to see behind us, but in September 2013, we had 42.7 million uninsured peoples. In February of this year, we were down to 19.9 million uninsured, so it was about 20 million people got insurance, but most of it went into employee-sponsored insurance. About 6.5 million got more Medicaid, and then a few got in the marketplace. So there's still 20 million people, even after the Affordable Care Act got into place, that don't have insurance in this country, and all these expensive machinations to get insurance for them through private companies being subsidized or supported and all of this. So it's still a failure, is it not? The American health care system?
Yes and no. It's not a failure because we are covering more people under the poverty level. It also puts us in a position where we're seeing how the marketplace works. And as Winston Churchill says, America always ends up doing the right thing in the end, after they've tried everything else first. And but we're hoping that this is the penultimate, that this is the last thing that they're going to try before they go to a Medicare for all system.
Let's put a chart up that shows where America is. We have the chart on the per capita cost. There it is. Again, this is an interesting chart because it goes from, well, I think sort of backwards. I would normally think it would go there, but the column on the very far right of your screen, or I guess it's the left as you look at it, is the American cost of per capita cost of providing health care in this country. Now the number I have here, and you might have a different number, is something like $8,500 per person. The average of all those, the one in the center there, these are the most modern countries in the world, industrialized European countries, the Asian countries, others that provide decent infrastructure for their citizens. The average price in the middle was something like $3,500, the median price. So we're like almost 3 times, 2.5 times per capita cost of these countries. A modern system along the lines that these people do, Medicare for all, single pay, could save, in theory, how much? Trillions of dollars?
The estimate just for the administrative costs is about $500 billion. Now we spend almost $3 trillion. When I started volunteering 15 years ago, it was $1.2 trillion. Now it's up to $3 trillion. So part of that graph shows the increase. I mean, all systems are going to increase in cost, but we've just gone through the roof. Not only have we gone through the roof in cost, but in the number of administrators that are being used, something like 3,000% increase since the 1970s in the number of administrators to run the system.
Well, most people attribute the cost of privately routed insurance. Insurance companies. You know, I hate that phrase because I think it's misleading. The idea of insurance sounds like it's benign or something that we want, but when you say insurance, you're talking about insurance companies.
I think the key word is for-profit.
Yeah, for-profit.
We need insurance. We need non-profit insurance.
We need something that protects us from the dangers of not having care when we need it. and that would be insurance.
And having a corporation that is looking for profit as opposed, not maybe opposed to, but they're looking to the market to please the market and their shareholders.
And trying to sell a product too.
Right.
They are
And trying to be
product.
sure that they get healthy people so that they don't have to pay a lot for the cover.
Oh, yeah.
So,
Well, there's a couple of things that we have to understand when we understand why the private sector is left 20 million uninsured. You know, if there's 20 million people in America that still don't have insurance after the Affordable Care Act went into place, and the private sector claims that they can provide this coverage and haven't done it. One of the things that I came across was that about 35% of medical dollars are spent on bureaucratic process, administrative process in private insurance. Have you heard numbers along those lines?
well, since the Affordable Care Act, there was a cap put on, but that's
80%.
That's very flexible. It used to be 30 to 35%. It's probably closer to 20%. The insurance companies are very good at fudging, and so there are things that are put in as medically necessary, but they're actually administrative costs.
And what is that you gave it earlier? I'm sorry I stepped on you there. Finish your thought.
That's okay. No,
Earlier you mentioned it by reference. I heard a different figure, but you said something. I heard that the cost of Medicare administration in bureaucracy is something like not more than 3%.
Yeah, 1.5 to 2.
1.5 to 2, or as much as 3%, depending on, I guess, how you figured. But wherever it is, it's less than a tenth.
Yeah, if you look at Canada, their hospitals might have a little closet space for their bookkeeper, whereas we often have as many people in the hospital shuffling forms as we do people on the floor providing service.
I think I saw in the LA Times this morning one of the major insurance companies in California, their executive was being interviewed by a reporter and was asked them about the increases in salaries that they gave to their executives last year. I think it was a 65% increase or something in salaries to the top end people. And he was dancing around how that affected rates and premiums and profit, but he couldn't really answer it. But that's along the ways of how you talk about where they can fudge about their administrative costs. If they're spending on salaries for administration, it may not be part of that 80% limit that they have. But in any event, it's a huge amount of overhead.
Oh, yeah, and that could be used for care. In all of the financial modeling that's been done, there are several dozen states that have done it. There's been one done recently for the U.S. All show that if we took the money that we could save by negotiating prices for drugs, for example, we could save probably 40% on that. Like I say, $500 billion on administrative costs, $100 billion on drug prices. So there's an enormous amount of money which could then be used to take care of people. We could provide dental care as part of the program. We could pay the general practitioners more. I mean, so much money is being funneled into specialty care that doctors going to medical school are opting for specialty because that's where the money is. And a lot of the proposed single-payer plans that are put forth give incentives to general practitioners to go to rural areas that are underserved or inner city areas that are underserved, as well as raising the general rates for the general practitioner.
The need to have more medical care providers, not just doctors, but nurse practitioners and all of that, and pharmacists, and expanding the duty. That's a subject we could probably spend a half an hour on. And maybe we should soon. But I have seen studies that say that the huge inflation in healthcare costs in America and the United States has not been the result of huge increases in the monies being made by the actual doctors, the medical doctors. I mean, they're getting well, they're doing well, but it's the insurance companies again. I don't know if we have that other chart that's back there. Maybe we can get that up on the screen. It's I think it's a chart that shows the overhead or the increase in the cost over inflation over 10 years. But it's a huge amount of money. Somewhere in the neighborhood of, I've got a figure here that says that more than $1 trillion. The private insurance-based Affordable Care Act will add more than $250 billion to the already high administrative costs of U.S. health care through 2022. Nearly two-thirds of this new overhead, $172 billion, will go for increased private insurers' administrative costs and profits. Again, it's not that it's going into the businesses of insurance, not into the providing more doctors or nurses or facilities or healthcare workers or anything. It's just purely the bureaucracy and the profit in those businesses. Right. And that's what's frightening. I think that's frightening. It should be frightening to people.
What people should also know is that a recent report came out showing that inflation in the premiums is still there, and it's far above what the inflation rate is overall. But where the inflation is occurring and is hidden is in your deductibles.
I was going to get to that. That's actually the chart that I was trying to get up on the screen. Since 2010, the numbers I have, and if we can get it up there, the amount of deductibles increased by 67%.
Right.
So, and maybe in 2010, you expect your family deductible to be $500. Now it's like $800. And that's actual increase in premiums that people don't see.
And that's if you get one of the better plans. And people are getting, under the Affordable Care Act, they're getting the bronze plan because they can't afford the silver plan. But in the bronze plan, they have an enormous deductible to meet, first of all. So if they really get sick, then they're going to have to pay that.
The point I'm trying to make, I hope, and I'm trying to make clear in my own mind that I make it clear to the audience. When you are told that your premium for your insurance only went up 10% or 5% or 4% this year, but the deductible has gone up $100 or $200 or $300 or $400 or $500, that's an increase in the premium. That's an actual increase in the cost of the plan.
Yeah, that's total cost.
All those things together, all this huge profits being made by these insurance companies, bring me back to the subject I was trying to get to, how we pay for a single pay. Bernie Sanders said on that debate with Hillary Clinton, and actually it was in response to a jibe by the moderator, that it would be paid for by the profits that weren't going to the insurance companies. But with just eliminating the profits to the insurance companies and going to a Medicare model in which it was 1 or 2 or 3% overhead, we would save enough money to provide single pay health care for all the people in this country that would want it.
Right. Under a single payer, the mechanism is often through a payroll tax. A lot of the proposals use payroll tax. And so it would be proportional to what you earn. So you don't have to buy a cheaper plan that has less benefits. Everybody has the same plan, the same benefits, and you pay according to what you earn. So we wouldn't spend any more than what we're spending. Actually, we spend less in total. But a lot of we'd still have to pay. Everybody would have to pay in. They would pay in according to how much they earn, just like we do with Social Security, just like we do with Medicare. It's a percentage of the payroll tax.
So, a way forward. I know there's nothing currently active in California to change the situation there as we had a few times in the past.
That's right. Governor Brown did sign a bill just this last week that would include undocumented children.
As being entitled to receive Medi-Cal, which is indigent aid.
Right, and that would, I think, about 500,000 children would be.
And then there's another proposal that didn't get passed that would allow people to buy it.
That's correct.
Who are not citizens.
Without subsidized.
They would just be able to buy it at full cost.
Right.
But that didn't get passed.
No.
Or signed.
No, it got removed from the bill.
Oh, it didn't get in there at all. Okay.
They weren't sure about the funding anyway. So.
But looking outside of California, we have a few minutes left. I know we want to talk about this. There is a proposal in Colorado as an alternative way forward to create a single-pay system in-state under the Affordable Care Act provisions. Can you talk about that?
Yeah, as I mentioned earlier, there's a provisions allowing states to do this. Their proposal would be would cost 3.5% for the worker and 6.5% for the business in terms of coverage, in terms of payroll tax.
The employer would pay 3.5% of their salary, and the bought business would pay 6.5%.
Right.
creating a 10% assessment.
Right. And for most businesses that now provide healthcare benefits, it would cost them less.
And they would do what?
The proposal included dental benefits for children and otherwise complete benefits, hospital, doctor, and so on.
So in Colorado, if this were to pass, they would get rid of insurance companies?
Well, private insurance companies would essentially go away except for specialty policies. In Colorado, it would also provide the medical portion of workers' compensation, and they would do that at a great reduction in cost. Medicare would stay the same, veterans benefits would stay the same, but the Colorado system would be a supplemental policy, so that a person could go to the Colorado Care system, they would get their treatment, the Veterans Administration, Medicare would pay its share, and Colorado Care would pay the difference. So it would be like having, on Medicare, it would be like having a Part D policy.
So I would be automatically enrolled, and I understand this as any resident, any person living in the state of Colorado would be automatically entitled to go to get medical assistance, hospital, doctor, dental even, just by the fact they're present in the state.
That's right.
And even if they weren't paying taxes, they would not have to have a...
they don't have to be employed. No,
they don't have to have a little card that says, I'm a paid member.
No, that linkage took place during World War II, and anyway, it shouldn't be linked with...
They shouldn't. I mean, I think that people used to ask me with some derision if I thought medical care was a basic human right, and I thought, of course it is. I was surprised they would ask me this question, but there are folks apparently who think it's a luxury.
Yeah. Well, if people don't think it's a right, it's definitely a need.
I think it's a right.
And we all do pay for these things ultimately, one way or the other. Before we left, I wanted to before we signed off, I wanted to show
we're closing down right now.
that
Give me everything you have.
Okay. Well, if you support this idea, people really need to join us, join Physicians for National Health Program. There are lots of organizations out there. You just go to the internet and Google single payer.
Well, right, for all logo up on the screen, and if we can get the phone number up, there we go, and that's us. I want to thank the people in the back for their work in directing, Ali and Juanita. Also, we'll get one more shot here. What's your phone number, and how can people contact you or the organization?
My phone number is 682-5183. They go online to healthcareforall.org. They'll go to the home page and they can find the Santa Barbara chapter, and all of the contact information is on there.
And is anything expected of them by way of membership or
you can sign up for our email list and just get messages. You can become a member at whatever level you want. There's no minimum. And that money goes to pay for postage and all the overhead that nonprofits have.
Well, I'm on the mail list, and I do get some interesting information from it, so I think it's worthwhile just to keep up to date with the progress in these difficult areas. Thank you.
Yeah, thank you.